Hello, good afternoon. This is Dr. Majid Anwar. Today I am going to discuss about some common antiseptic dressings. So basically what is dressing? Dressing is a sterile pad or compress which is applied to a wound, and that causes protection of the wound from further injury, that promotes wound healing, and it acts as a exudate. Whatever exudate the wound liberates, it absorbs. There are various kinds of dressing. The dressing which are commonly used in trauma center, the first one is the saline dressing, which we commonly use in ED patient and in OPD follow-up patients. So this is basically a gauge piece. You can see this is gauge piece. So what we do, we just pour it in saline, just release excess of saline and apply it over a wound. So why we don't use antiseptic? Because using antiseptic, it will cause antibiotic resistance. So basically what we use saline impregnated gauze piece, right? The next we use is this dress core. You can see this is dress core. This is used in when we apply some stitch and when we remove the dressing, we apply it. This is basically just a pad, and this will cause absorption of excess liberated fluid. This will be absorbed, and this is so simple to apply and very comfortable to the patient. The next we use is Mapilex AG. This comes in various sizes. You can choose according to the wound size. Some they might be small, some they might be big. This is very easily applied. So basically it is what? It is a foam based dressing with added advantage of AG. So AG, what it does? AG has got antibacterial action. So when it is applied to a wound, it causes decrease in the amount of bacteria. So this is basically used in those kind of wound which has got high chances of getting infection, like deep venous ulcers or burn scars, or if the patient has got bed sore, which is commonly seen in a trauma patient who's got bedridden. So basically we use in such kind of wound where there is a chances of infection and also there is excess exudate. So foam, what it does, it absorbs excess fluid and causes the wound to be it prevents maceration. Maceration is what? When there is excess leakage of fluid, it causes the adjacent area to erode. So it prevents excoriation. The next is Alvin AG. Alvin AG, it is plain Alvin also is there, and Alvin AG is also there. Alvin AG is with added advantage of silver, like previously mentioned in Mapilex AG. And this is Alvin. This is also a pore based dressing. It absorbs the excess exudates and causes the wound to be not to get too much of fluid there. We can apply it, leave it for 4 to 5 days, and then we can remove this. This also comes in various sizes. Some are big, some are small, for different sizes. So basically, what we use in ulcers, all kinds of ulcers, deep venous ulcers, burns, and in cases of where there is a raw area, we use it. Then new things have come up as we get to know about the pathophysiology of the wounds. We have got adapted to using those multiple kind of dressing. This is a recent one. This is a sterile collagen sheet, and this collagen sheet is basically, it is derived from animal based collagen from pigs or some bovine, and what it does, it causes the epithelialization. That means when it is applied, it causes the new cells to form in this collagen scaffold. This is collagen scaffold, and these cells, they keep growing. So they are mainly used in those kinds of wound where there is a chronic deep wounds. That means if the wound is chronic and wound is not getting healed, then we apply such collagen sheet. We also use in first and second degree burns, then ulcers commonly we use. Then this jello net. This comes in, you can see this, can you appreciate, this is jello net dressing or gypsum net dressing. This is basically a paraffin gauze dressing. So what is this when we do a donor area or a recipient area is there? So what we do, we just apply this to the donor area where we take the first or second degree graft, partial or deep thickness graft. When we take, we apply this to the wound, and this takes care of the wound. That means it absorbs the excess of the fluid and it prevents infection. The last one is, this is Axiostat. This is mainly available in the ED area. So what it does is, it's basically arrest bleeding. So we don't commonly go through this kind of dressing in a ward, but we use it in ED. When we apply, this causes topical hemostasis. The other dressing is one or two dressing. These are all new dressings. One is Hydrofara blue dressing. So Hydrofara blue dressing is basically what? It's a combination of two organic solvent, methylene blue and gentian violet. This is basically a blue color dressing. So unfortunately I don't have at present, so I'm not able to just let you see. So basically it is used in those kind of infected wounds. It has got very good antibacterial properties, broad spectrum. So it causes exudate, whatever exudate is there, it takes away the exudate, and this also helps in autolytic debridement. That means all the necrotic and debrided tissue, they are washed off. And this is also non-cytotoxic, and it provides the moist environment to the wound. So basically what it does, it protects the wound from infection, then it promotes healing, it promotes angiogenesis, and so the chronic wounds which have not healed for say 3 or 4 months, in that scenario we can use this Hydrofara blue dressing. The other small one dressing is also there, which I don't have. This is Bactigras. This is basically a chlorhexidine containing, like this paraffin gauze. This is similar to the Bactigras, but there the impregnated powder is chlorhexidine, and chlorhexidine, as you know, this is both bacteriostatic and bacteriolytic, and active against both gram-positive and gram-negative bacteria. So what it does, we use in those kind of wound where there is wound infection, and it decreases the bacterial count and it promotes wound healing. Thank you.